Arizona Medical Marijuana Policy Project, last name MYERS. And we're here today to turn in the work of the last 11 months. We've collected over 252,000 signatures from Arizona residents, Arizona voters, in order to qualify this initiative for the ballot. And we're very excited that we're here today. And what this initiative is about protecting patients who are using marijuana with their doctor's recommendation from arrest and prosecution. We're talking about people who have severe, in many cases, terminal illness, and they have conditions that scientific research has shown that marijuana is a safe and effective treatment for their condition, and they're using marijuana under their doctor's care. This initiative will permit qualifying patients and their caregivers to legally purchase their medicine from tightly regulated clinics as they would any other medication, so they need not purchase from the criminal market. It will permit qualifying patients and their caregivers to cultivate their own marijuana for medical use if a regulated medical marijuana dispensary is not located within 25 miles of their home. It will also create registry identification cards so that law enforcement officials can easily tell who is a registered patient and establish penalties for false statements and fraudulent ID cards. Allow patients and their caregivers who are arrested to discuss their medical use in court, and keep common sense restrictions on the medical use of marijuana, including prohibitions on public use and driving under the influence. We have a couple other people here to speak today. First of all, I want to introduce Dr. Sue Sisley, who is a very prominent local physician and an advocate for the responsible use of medical marijuana. Thank you.
Can we get your full name and spelling, please? Sue Sisley, Sisley, and I'm an MD.
Where do you practice?
I'm at a variety of locations: St. Joseph's Hospital, University of Arizona College of Medicine, and in private practice.
Dr. Sisley has prepared remarks if we can allow her to give those.
Yes, all
Do you have a specialty, just for a background?
Sure, yeah. My specialty is internal medicine and psychiatry. I'm trained in both, practice both. So I'm here today as a doctor and a scientist. Many times I've been in the trenches with patients who have exhausted all other pain and nausea management options that are legally available for me to prescribe. Too many times my hands have been tied, and I've had to tell patients there's nothing more that we can do for you. Medical marijuana is not yet authorized in Arizona, but it is my sincere hope as a concerned physician and on behalf of thousands of physicians across the state of Arizona who share my concern, it is my hope that today we begin the process where common sense and compassionate medical marijuana allowance in Arizona is finally embraced, as it has been throughout this country. The evidence is overwhelming that medical marijuana, it does relieve pain, nausea, vomiting, and other severe symptoms caused by such illnesses as multiple sclerosis, AIDS, and cancer. And medical marijuana can do this with remarkable safety. In fact, marijuana is less toxic than many of the drugs that we physicians prescribe every day. Seriously ill patients who use medical marijuana do not get intoxicated. They titrate their dosage to obtain the needed therapeutic effect, and then they stop. Scientific studies have conclusively demonstrated the value, the medical value of cannabis, and available antiemetics often prove ineffective for patients. They often result in patients continuing to have malnourishment, intractable nausea, weight loss, delayed chemotherapy treatments, and decreased survival rates. However, seminal studies by Dr. Donald Abrams at the University of California in San Francisco show that patients receiving medical marijuana have improved immune function and compared with those receiving placebo, and many of those patients gain 4 pounds on average over those patients getting placebo alone. The evidence compiled by renowned investigators throughout this country and published in peer-reviewed medical journals show the remarkable and undeniable health benefit derived from medical marijuana. So the point is simple. It is vitally important that seriously and terminally ill patients have legal access to safe and effective means of treating their illness, the potential benefits from medical marijuana greatly outweigh the risks. The Arizona Medical Marijuana Initiative allows doctors to provide the highest standard of care in taking care of patients and allowing compassionate use of medical marijuana for seriously and terminally ill patients with a doctor's recommendation. I urge anyone who has personal experience with a devastating disease or who knows someone who has battled with such an illness to vote yes for medical marijuana in Arizona. For those of you who have been lucky enough to avoid serious illness and have never touched marijuana, I urge you to consider this possibility. Someone you love may require medical marijuana someday. Please support this proposition. The current and future patients of this great state of Arizona will thank you, and I thank you all for your attention.
Thank you, Dr. Sicily. Next, we have Heather Torgerson, who is a medical marijuana patient and an advocate for the cause.
Spell your name.
Heather Torgerson, T as in Tom, O-R-G-E-R-S-O-N.
And you're a medical marijuana patient, obviously not from Arizona,
I am from Arizona.
so you're taking it illegal.
I am.
Questions at the end.
For what, Alan?
This is a very special day for me. 3 years ago to this day, I woke up from an 8-hour brain surgery and was told I had 6 months to live. My family as well was told 6 months is what I would have. I was terminal. I could undergo the chemo and the radiation treatments, but my chances of survival were very slim. I still chose to go ahead with the radiation and chemo, and although it worked, I became deathly ill. I was losing weight rapidly. I was to the point where my next round of chemo I probably wouldn't be able to take because my white blood cell count was too low, my weight was dropping too fast, I wasn't healthy enough. So I came to a choice of basically, either the cancer is going to kill me or the chemo is going to kill me. It was tough, and like Dr. Sicily was just saying, my doctor had exhausted all the options she had available legally to provide for me, to avoid the nausea, to avoid the pain. We tried everything, and finally I had to find my own way, and it became medical marijuana, and it worked. As soon as I started the use of it, my weight increased, I was able to eat, so therefore I was able to take my chemo, and now I've been cancer-free for 2 years. So I am the face of a patient standing here because of the use of medical marijuana. If it wasn't for it, I would probably not be here. So once again, like Dr. Sicily said, for anyone who this has not touched in your life, that's awesome. I've been in those shoes. I wrote a paper against this in college because I did not know what it was like to be on the other side of the fence. And I am. And now I know what it's like, and no one should have to suffer when there's a cure.
Where do you get your
I find friends that get it for me, and I would much rather not live every day in fear that if I have my medical marijuana on me that I could go to jail. By passing this, I don't have to have that fear anymore, and I don't have to find someone to get it for me. I can get it, it'll be regulated. I don't have to wonder what kind I'm getting, how it's going to affect me. I'll know it'll be